In this video, I'll be explaining anatomy and radiology of retroperitoneum. We'll see the gross anatomy illustrations and then the CT images. As the name itself suggests, retroperitoneum, whatever is behind the peritoneal cavity is the retroperitoneal cavity. So this layer in yellow is the parietal peritoneum. Whatever it contains is the intraperitoneal cavity. Here whatever I'm drawing along the transverse abdominis muscle is the transversalis fascia. Retroperitoneal cavity is the one in between parietal peritoneum and transversalis fascia. So it's behind the peritoneal cavity as we can see in this image. Let's see this on axial CT images. These are non-contrast axial CT. Here somewhere will be the peritoneal layer and this is the peritoneal cavity in yellow. This is the transversalis fascia and this is the retroperitoneal cavity containing kidneys, duodenum, pancreas, etc. We'll see the contents shortly. Intraperitoneal cavity and retroperitoneal space. So here we can see head of pancreas, duodenum, the descending colon, kidneys. What are the contents of retroperitoneum? There are organs like kidneys, suprarenal or adrenal glands, pancreas. The vessels are in IVC, aorta and its branches. Bowel loops are duodenum, ascending colon and descending colon. Second and third part of duodenum are the content of retroperitoneum. Basically, retroperitoneum has many compartments and internal spaces, and these organs are in different spaces which we'll discuss in detail now. In this video, we are going to see the compartments of retroperitoneum. There are 5 compartments, 2 lateral compartments, 1 central compartment or vascular compartment and 2 posterior compartments. So there are 5. Each lateral compartment is divided into 3 spaces each by renal fasciae. So there are anterior renal fascia on either side and posterior renal fascia. This divides lateral compartment into 3 spaces. They are anterior pararenal space, perirenal space and posterior pararenal space. We'll discuss each compartment one by one. Coming to 2 lateral compartments. So 2 lateral compartments are right and left and they are asymmetrical. So here I'm outlining it in blue. This is one lateral compartment. This is the other lateral compartment. So this is nothing but one lateral compartment and this is the other lateral compartment. There is one central compartment which is also known as vascular compartment. So in between these 2 lateral compartments there is central vascular compartment of retroperitoneum. Remaining is 2 posterior compartments of retroperitoneum. So behind the 2 lateral compartments we have this in green color what I'm outlining. These are the 2 posterior compartments of retroperitoneum. This is lateral, central vascular and posterior compartments of retroperitoneum. So there are totally 5 compartments. We'll see how it looks on CT. Again I'm outlining it in blue. These 2 are lateral compartments. And in between 2 lateral compartments there is a central vascular compartment having IVC and aorta, the major vessels, behind which we have 2 posterior compartments. So this is compartmentalization of retroperitoneum into 5. Central vascular compartment extends from D12 to L4, L5 vertebra and each compartment has subdivisions again with contents within, and also there are communication of these peritoneal spaces with other spaces which we'll see. First is the lateral compartment which is divided into 3 spaces by 2 fasciae. This is the anterior perirenal fascia anterior to the kidney. This is also called fascia of Gerota. There is posterior perirenal fascia which is also called as fascia of Zucker-Candle. And these 2 will fuse laterally to form lateral conal fascia, which will then attach itself to the parietal peritoneum. So now lateral compartment is divided into 3 spaces because of these fascia. So these spaces are anterior pararenal space, which is anterior to Gerota. Posterior to Zuckerkandl, we have posterior pararenal space, and around the kidney it's perirenal space. So the 3 spaces were anterior pararenal space, perirenal space, and posterior pararenal space. We'll see how they look and what are the contents. So this is anterior pararenal space. This is perirenal space, and behind the kidneys we have posterior pararenal space in green. Contents are anterior pararenal space contains ascending colon, and the opposite side it contains descending colon. It has duodenum and pancreas, which is shown in the diagram here. Perirenal space contains kidney, adrenal glands, its vessels, ureter and lymphatics. Posterior pararenal space has nothing but fat as its content. Again, don't get confused. Posterior pararenal space is a part of lateral compartment of retroperitoneum, and it's different from posterior compartment of retroperitoneum. Okay, don't get confused between these two spaces. We are done with lateral compartments. Now we have central vascular compartment. This lies between two perirenal spaces exactly to tell. It extends superiorly from D12 to inferiorly L5 L4 vertebrae, contains aorta, IVC and its sympathetic plexus. Coming to our last compartment of retroperitoneum, that is posterior compartment. The contents of posterior compartment is still not standardized in literature, and there's still confusion whether psoas comes in the posterior compartment or not. Remember, posterior compartments are not exactly behind the kidneys, they are medial to the kidneys. Content of this compartment is psoas muscle. As we go down, it becomes iliopsoas muscle, but it's still considered a part of retroperitoneum, even though it is behind the transversalis fascia in the lower down sections. We'll see the same in axial non-contrast enhanced CT sections. So here in lateral compartment we have anterior renal fascia in blue, posterior renal fascia in green. It has two slips. You can see it will cover the vascular compartment. Then both of them fuse to form lateral conal fascia, which will join the parietal peritoneum. This in yellow is the parietal peritoneum. Now we look at the spaces. This in blue is the anterior pararenal space. Here in green is the posterior pararenal space, and the kidney is contained in the perirenal space or perinephric space. Next we have the central compartment. This is the central or the vascular compartment. Lastly we have the posterior compartment. Here we have the posterior compartment. Now the lateral compartment is constituting of these three spaces. Most important space among all the spaces which we discussed is the perirenal space. We'll discuss this in brief. So here we have Gerota fascia in blue and Zuckerkandl fascia in green. This is the perirenal space containing kidney and adrenal glands. So in longitudinal section, this is inverted cone shaped. So this in blue is the anterior renal fascia. This is the posterior perirenal fascia. They form a cone shaped containing kidney, ureter, its vessels and adrenal gland. Inferiorly it reaches up to the pelvis. So this space reaches up to the pelvis. Both on right side and left side we have perirenal spaces, and both are little different in its boundaries. So this is on right side, this is on left side. On right side what happens is it is directly in contact with the bare area of liver, not covered by peritoneum. We'll see sagittal sections. I'll show the diagrammatic illustration in sagittal section how it looks. So liver and its bare area is somewhat like this. Anterior perirenal fascia attaches to the fascia of the liver, and posterior perirenal fascia is coming down from the diaphragm. So superiorly, the perirenal space is directly in contact with bare area of liver. This is on right side. Now we'll see on left side. On left side, what happens is both anterior perirenal fascia and posterior perirenal fascia attached to the diaphragm. So here we have the spleen, behind which anterior perirenal fascia, posterior perirenal fascia attaches, and here what kidney and adrenal are contained in. It's very difficult to see the perirenal fasciae in normal cases. So I'm showing you a case where pyelonephritis is there and perirenal fascia are thickened. Only when they're thickened they're visible. So here now we see left kidney. It's inflamed. You can see how bulky it is, and this here thin line is the anterior perirenal fascia. This thin line here behind the kidney is the posterior perirenal fascia. So both fuse to form the lateral conal fascia, which is attaching to the peritoneum. Go on following this perirenal space. We move down. Here you can see that bulky kidney with certain non-dense areas. So this is anterior perirenal fascia or fascia of Girota, and posteriorly we have the posterior perirenal fascia or fascia of Zucker-Candle. So these fascia are visible only when they are thickened, this much at least. Both of them fuse to form this lateral conal fascia. This slip of fascia you can see, it will go anteriorly attached to the parietal peritoneum. That's the lateral conal fascia. So all fascia are thickened here, and there's so much of fat stranding around the kidney in perinephric fat space. As we move down, we can see this space very well defined by the fascias, and the space is also continuing till the inferior aspect. So we go down. As we go down, we start seeing the iliac bone. So this is the pelvis, and the space extends till the pelvis. Here you can see how inverted conical shaped space this is, extending till the pelvis. Lastly, we see the communication of these spaces with each other. First one is the knee land space. It is said that both perirenal spaces, the right and left one, communicate with each other anterior to aorta. But it's still in doubt. Next, anterior pararenal space. It is continuous across the midline. See, here it is continuous across the midline, we can see. Next, we have the posterior pararenal space. Posterior pararenal space is again continuous across midline, and it is also said to communicate with the properitoneal space anteriorly. See here, this is the transversalis fascia, and this is the space between transversalis fascia and parietal peritoneum. This is properitoneal fat space. So posterior pararenal space is continuous anteriorly with this properitoneal space. Also, posterior pararenal space is continuous across the midline. So here you can see anterior to vertebra, it is continuous across the midline. Perirenal space, especially of the right side, we are talking about the right perirenal space. Superiorly, it's continuous with the retrohepatic space at bare area of liver. We saw how the fasciae are attached. Lastly, the central vascular compartment is continuous with the superiorly, it is continuous with the posterior mediastinum, where large vessels of mediastinum are present. What all we learnt in this talk? We learnt about compartments of the retroperitoneum and how are the lateral compartments divided into three spaces by two renal fasciae into three spaces: anterior, perirenal and posterior pararenal. Like, share and subscribe to our YouTube channel and Instagram channel. Please share these videos and follow our channel. Every week we'll be uploading new videos on radiology. Thank you.